But again, like time comes when our body needs support from us, and when regenerative medicine can really help. And we are talking about like varieties of methods. Like from my point of view, the fundamental one is prolotherapy. Another name for prolotherapy is non-surgical reconstruction of tendons and ligaments. Why tendons and ligaments? Because especially ligaments and joint capsules and again tendons, they're providing the support for the skeleton, for musculoskeletal system in general.
Yes.
And when joint, for example, has a good solid durable joint capsule in ligaments which keep joints together, because joint is just it's two bones, and to make these two bones like functional unit we need so-called supportive structures, joint capsule, tendons, and ligaments which attach muscle around the joint to the bone, and ligaments which connect bone to bone. And when all the structures are good, solid, and durable, joint will have good support and will move properly. As soon as these structures become like loose, joint loses stability, and we gradually start to injure itself, and we're developing the arthritis most of the time. Another job for these supportive structures are to let our brain know in what position we are in a space. That's why these structures have a lot of nerve ending.
Got it.
And when the structures become compromised, injured, degenerated, overstretched, it will irritate nerve endings, and it will give a lot of pain. So a lot of time, the main pain source, not just the joint itself, like in between the bones, the space between the bones, but the structures around it. And unless we will address them, which prolotherapy does, we really cannot get good, solid control of the situation.
Okay. That's what you're saying. The pain is the messenger there. It's just
pain is the messenger. Don't kill the messenger. Look why you're getting this message.
Yeah, look why you're actually in pain and how you can deal with
Absolutely.
that. Yeah. So prolotherapy specifically, so that's what you would use prolotherapy to take care of, but what is it specifically again?
Yes, so again, like I said, another name for prolotherapy is non-surgical reconstruction of tendons and ligaments.
Okay.
It's a series of injections, and which will stimulate, which will provoke good controlled inflammation, which is the first stage of healing. Without inflammation, further steps of healing will not follow. So again, when we injure ourselves, what we have pain, we have swelling, we might have like the area hard to touch. All of these signs of inflammation. So our body designed to create the inflammation. So it means we need inflammation for some reason. But again, everything's good in moderation. If we have imagine if you have like candle, you have like nice light and like cozy environment, but nothing more than that. When you have fireplace, you have like warm, nice room. But if your house is on fire, it's very dangerous thing. So the same with inflammation. So inflammation should be at the right time, the right place, right intensity, and right duration. So if everything is like properly structured, if you will, so it's a healing mechanism. At the beginning of the healing process, inflammation will activate immune system, and immune system will activate all this like healing process. Again, coming back to conventional approach, but again, inflammation comes with some pain and discomfort, and we're as a society, we're spoiled. We do not want to tolerate any pain, any discomfort. Most of the time, we're looking for the quick fix, and we have to run. So we're taking a lot. We take pain medication, a lot of them like anti-inflammatory, and we're killing inflammation in the beginning. So we're not letting our body even try to heal itself.
Wow,
and because
I don't think I've ever actually thought about it that way.
Exactly. So again, if we have inflammation, it means we need it. If it's too much inflammation, of course, it has to be like under proper control. But again, we need inflammation to start the healing process. So when we take anti-inflammatory painkillers, we're stopping the self-healing initiation of the body, and we actually transforming the acute injury into the chronic pathology. And because our body has a huge compensatory ability, we can compensate the incompetent zone for other lengthy periods of time. And we might have injury like when we're 20, 15 to whatever, like early years in our life. And we didn't give chance our body to heal properly. And when we're 50 or 60, like all of a sudden, we start to have like, our like knee arthritis, bone on bone, all of a sudden. It didn't happen overnight. So probably something was happening like a while ago, and body was compensating. And most of the time, we start to have symptoms not when the acute. Most of the time, we start to have symptoms not when the problem occurs, unless it's acute injury.
Okay.
We start to having symptoms when body cannot compensate it anymore. And with the coming back with the prolotherapy, we are recreating kind of like acute injury, if you will, with this gentle injections. And we are recreating good controlled inflammation, which is the beginning of the healing, and body will do the rest.
Got it. So you're pretty much with Prolo, if I get that right, you are mimicking what the body might have done when it was
in the beginning of the
capable.
process. Yes, okay. Exactly. So we're recreating good controlled injury, good controlled inflammation, and we kind of reversing we making the process which used to be acute and became chronic for whatever reason, or maybe because of the medication we're taking to suppress the inflammation, or for some reason. Healing process didn't go all the way, or didn't go the right direction. And we kind of like recreating the acute situation. For body, much easier to get the acute situation under control versus chronic. And body will do the rest. And like we said, the prolotherapy, from my understanding, from my belief, it's the fundamental like approach. And another thing, the philosophy of prolotherapy, the comprehensive treatment, the entire region, not just the one spot which like bothers the most.
Okay.
A lot of time patient come and say like pinpoint, like, I mean, my knee hurts, but the most painful area like in this spot. Yeah. And of course, important to address this particular spot. But in reality, we have to address the whole region, not just the one spot which hurt the most. And this is a philosophy of prolotherapy, because you have to treat the whole territory, because the spot which hurt the most probably took the bullet, but it happened because the other like areas of this like joint, whatever, didn't do the good job.
They weren't supportive enough.
Yeah, they were not supportive enough, and this particular like spot like suffered the most. So we have to treat the whole region. Like imagine you have like orchestra and all musicians kind of okay, but two of them horrible. So if you will replace those horrible with okay musicians, you still will not get the best music in the world. You have to retrain. You have to like retrain the whole orchestra to work better and together, to get the like excellent music. And the same happening with the body. So you have to treat the whole area. And you have to, a lot of time you have to look, you have to be like, a lot of time doctors should be like a detective. We have to try to figure out why this particular area hurt.
And
what
be
happened.
With it
yes,
bit,
absolutely. Yeah. Yes, what happened. Maybe something happened 20 years ago, 30 years ago. And this area, like, became the first one to manifest the issue. And unless you will address the area, like maybe a remote area of the body, which was like initial injury, which triggered the pathological changes in other part of the body, which like screaming now, and you really have to like treat all of this to get the good salvage result. But it's possible. Body is extremely appreciative creature, if you will.
Yes.
As soon as we'll like get everything that is necessary, we will get the good outcome.
So I'm sure, it varies over many patients, but do you see a certain timeline of when you actually start to see some results from that type of therapy? like at least like the start of some results, and then I'm sure it can take maybe months to years. But what would you say like the timeline is on seeing results?
Yeah, of course, again, the longer negative changes were going on in the like body, the more time body will need to get it under control. But at the same time, these treatments, they're very effective in people. Like again, the negative changes were going on gradually, like in the same way positive changes most of the time happening gradually. But in average, most of the time, patient will see difference like in 2-3 weeks after first treatment.
Wow.
Yes,
That's
rather
pretty,
quickly.
yeah, that's pretty
For
bad.
some patients, when situation is extremely advanced or immune system not at the its best, or like nutrition is compromised, not enough like vitamins, like minerals, whatever. Like if something is missing and not at the perfect situation, so sometimes patient might need like second treatment just to see the difference. Extremely rarely third treatment. Again, people different, but I think about like at least 80% of patients will see the difference, positive changes like in 2-3 weeks after first treatment.
Okay. And because it's the regenerative approach, is it something that becomes long lasting, or is it something you have to continuously do?
It depends.
Okay.
If it's a focal injury and pathological changes didn't go like very far, so enough treatment, and usually like we're saying, like again, everybody's different, we cannot just say how many treatments, but in average, like very rough average, it goes like between 3 treatments to like age divided by 10, kind of like this like interval. We can actually treat area and person might just forget about it. On one hand. Another hand, if for example we have like situation which is like provoking the compromisation of this area. For example, a person had like one joint replaced and another, and he or she would like to like avoid the other joint to be replaced. But because of the surgery was done, the gait is kind of a little bit not like perfect, and so it's impossible to make like everything. Nobody is perfect, and body is not perfect. And for example, in gait, it's like a little bit some disbalance in gait. Or some patients, for example, have genetic predisposition to have a loose connective tissue. In their ligaments, more loose, they're more stretchable but less durable. These type of people, they can be great dancers, so they can do like whatever exotic movement. But there's price for everything. Because they can do that, joints have less support and they're more prone to injury. For those type of people, as soon as we will get like major situation under control, from time to time they might need touch-up treatment, maybe once a year, once in 2 years, every 6 months, depend on the situation. For some patient, it might be like definite like the final solution of the problem, but for some patient they might need from time to time kind of like maintenance, if you will.
Yeah, no, that makes sense.
Yeah.